Then the clinical features seen in case of the methyl isocyanide poisoning are: on the inhalation, immediate symptoms include the lacrimation, photophobia, lid swelling, and the corneal ulceration. Respiratory symptoms may include the cough, choking sensation, dyspnea, chest pain, hemoptysis, and pink frothy discharge from the nose. Pulmonary edema is the severe complication along with the less common symptoms like the vomiting, convulsions, coma, and the metabolic acidosis. Dermal exposure results in the erythema and the vesiculation. Ocular exposure can cause the permanent damage. Then the Bhopal eye syndrome that were observed in those patients who survived the Bhopal gas tragedy. The exposed population in the Bhopal experienced the increased incidence of trachoma, lead infection, irritant symptoms leading to the long-term eye complications. This came to be known as the Bhopal eye syndrome in case of methyl isocyanide poisoning. Then the sensitization and asthma-like attack are seen in case of the methyl isocyanide poisoning. Single exposure can sensitize individual and leading to severe asthma-like attack upon the subsequent exposure. As we talked, type 1 and type 2 hypersensitivity reactions seen in case of methyl isocyanide. Airway responses can be immediate, late, or the dual. Methyl isocyanide also acts on the reproductive system. Methyl isocyanide crosses the placental barrier, leading to adverse reproductive effects and the teratogenicity. Long-term effects include the RADS feature, that is reactive airway dysfunction syndrome, high rate of spontaneous abortions, and increased perinatal mortality. Methyl isocyanide presents with a high rate of spontaneous abortion, premature deliveries that are observed among the women who are pregnant at the time of exposure. Surviving infants showed the multiple anomalies and the severe pulmonary changes upon the autopsy. Surviving infants showed the multiple anomalies and the severe pulmonary changes upon the autopsy. Long-term effect of the methyl isocyanide included the respiratory function and the visual acuity remained the abnormal among the survivors for at least 2 years post-incident. Lung function test revealed mainly the restrictive changes with a small airway obstruction and the interstitial deposits. Inflammatory responses were most intense in the severely exposed patients, contributing to the deteriorating respiratory functions. Then management of the methyl isocyanide poisoning. Exposure to the methyl isocyanide mainly occurs by the inhalational route and by the eye contact. They are the most common routes of the intake of the methyl isocyanide. Dermal routes of absorption could also be possible. In the case of the methyl isocyanide poisoning, monitor the vital signs, ECG, chest X-ray, pulse oximeter, peak airflow, arterial blood gas analysis, serum electrolytes, and the renal and hepatic functions in the symptomatic patients shall be done. Then the basic treatment guidelines in case of methyl isocyanide poisoning is the symptomatic management. HPLC, high performance liquid chromatography, is the specific and sensitive for detecting the methyl isocyanide level in the blood. Skin and eyes shall be decontaminated with the saline water. Remove the contact lenses and irrigate exposed eye with the room temperature with using the 0.9% normal saline or water for at least 15 minutes. Topical antibiotics may be beneficial for the eyes to prevent the secondary infection. Severe iritis may require treatment with the topical atropine or the home atropine. In case of ingestion of the methyl isocyanide, activated charcoal shall be given along with the gastric lavage. Then in case of ingestion of the methyl isocyanide, activated charcoal is beneficial. However, gastric lavage is contraindicated in case of methyl isocyanide poisoning. Most of the inhalational gases, the gastric lavage is the relatively contraindicated as it may be aspirated and it may cause the inhalational side effects. Drinking a glass of milk or water may provide the symptomatic improvement if the airway can be protected. In case of poisoning through inhalation, cover the face with a wet cloth. During the exposure, it may minimize the toxicity. Move the patient to the fresh air immediately. Monitor for the respiratory distress or observe for 72 hours for delayed onset of acute lung injury. Administer oxygen, endotracheal intubation and the assisted ventilation may be required. Bronchodilators and the corticosteroids may be beneficial including beta-adrenergic agonists and inhaled ipratropium bromide and the systemic corticosteroids. like the prednisolone that is given in the dose of 1 to 2 milligram per kg per day, treat pulmonary edema and the acute lung injury with the continuous positive pressure airway ventilation, CPAP therapy that is of very helpful, and in severe cases IPPV and the positive airway pressure ventilation. Antibiotics are indicated only with the evidence of infection, otherwise it is not recommended. Other supportive care like the caring of the patient's diet and other things shall be taken care of as per the need of the patients. Then in the management part, this is important to know that isocyanides are not the cyanide. Many persons by the name will think that methyl isocyanide is having the cyanide features, so they will manage the patient according to the cyanide. So, but this is not so. This is totally a different compounds from the cyanide poisoning. So, it shall be understood separately. So, the antidote for the cyanide poisoning such as nitrites and the sodium thiosulfate will not be used in case of methyl isocyanide poisoning. This is important to know related to the methyl isocyanide poisoning. Then in certain cases, there may be associated cyanide poisoning due to the mixing of the cyanide gas along with the methyl isocyanide. Because of that, certain cyanide features might come, but that doesn't mean that it is because of the methyl isocyanide. In those cases, it shall be assumed that they are likely due to impurities with the cyanide. Then in case of death due to the methyl isocyanide, at the time of autopsies, various features will be seen as those of the asphyxial signs. The features seen in the Bhopal gas victims' autopsies are of much help to diagnose the case of the methyl isocyanide poisoning. In case of Bhopal methyl isocyanide poisoning, the patients showed the hemorrhages, cerebral edema, cherry red discoloration, fatty liver infiltration and the renal tubular necrosis. Signs of asphyxia, pulmonary and the cerebral edema and the generalized visceral congestions were prominent. None of the features are quite the specific for the diagnosis of the methyl isocyanide poisoning. The samples shall be kept for the toxicological analysis. We will come to the collection of the samples in cases of the inhalant gases at the end of the asphyxiant gases topic. In that, we will learn what differently we have to collect the samples in case of the inhalant gases, and that is important to know because very often we receive the inhalant gas poisoning or suspected inhalant gas poisoning at the time of autopsy, and if we don't collect properly the samples, then it may have the loss of our important evidence. So, it is important to know the method of proper collection of the samples in case of the inhalant poisons. Then certain other important facts related to the methyl isocyanide. The Bhopal gas disaster of 1984, we already discussed at the beginning of the lecture. Then recently a new medical discipline called as the disaster medicine has evolved in the recent time, which is devoted to the efficient handling of the human casualties in the disaster situations. Disaster medicine addresses the effective responses to calamities with 50 or more fatalities, straining health services. So here it is important to note that in case of the disaster medicine, the number of deaths required and it covers is the above 50 or more. Whereas in case of mass disaster, it is considered the mass disaster if the death of the victim is more than 8. So this is the minor difference between the mass disaster and the disaster medicines. Then the certain historical disasters include the volcanic eruptions, chemical warfares in the World War I and World War II, and the industrial accidents like those seen in case of Bhopal gas, recent incidents involving carbon dioxide leak in Cameroon, fires in the New York clubs, gas drilling incident in China, and the terrorist attack using sarin gas in the Tokyo are the recent example of the historical disasters. Then another important fact to know in case of methyl isocyanide poisoning is the Gulf War syndrome. Thousands of the Gulf War veterans endure the chronic symptoms possibly linked to the exposure to the methyl isocyanide during the 1991 conflict. Symptoms included the fatigue, headache, body ache, ataxia, skin rashes and the memory loss, with potential causes including exposure to the burning oil wells or the organophosphates used in the chemical warfare. So, Gulf War syndrome is another form of the methyl isocyanide poisoning that is associated with the war crimes. So, this is all related to the methyl isocyanide. Then coming to the carbon monoxide. Carbon monoxide is a colorless, odorless, inflammable, non-irritant and the highly poisonous gas. It burns with a blue flame forming the carbon dioxide. It is produced by the partial combustion of the carbon containing fuels like the coal gases, charcoal, gasoline, kerosene, wood and the kerosene. Carbon monoxide poisoning may occur due to exposure to automobile exhaust, smoke inhalation in fire or the sleeping in the closed room with braziers, and other forms of the partial combustion may be responsible for this carbon monoxide productions. Carbon monoxide is usually expressed in the terms of the plasma concentration of the carbon monoxide, and it is usually in the form of the carboxyhaemoglobin. So, the carboxyhaemoglobin level more than 60% is considered to be fatal to death. A carbon monoxide concentration of more than 5000 ppm in air is lethal after the 5 minutes of exposure in humans. So, in this way, this is one of the fatal gas. Then the mechanism by which carbon monoxide acts, it binds to the iron containing the homeoproteins like the hemoglobin, myoglobin, cytochrome P450 and the cytochrome oxidase. It acts as a chemical asphyxiant and induces asphyxia. Carbon monoxide combines with the hemoglobin to form the carboxyhaemoglobin, thus reducing the oxygen carrying capacity of the blood. As the carbon monoxide has 200 to 250 times more affinity for the hemoglobin compared to the oxygen. So, when the carbon monoxide will be available, hemoglobin will join with the carbon monoxide rather than the oxygen. So, in this way, it causes the asphyxiation at the tissue level. Toxicoknetics and toxicodynamics of the carbon monoxides are: carbon monoxide is readily absorbed by the lungs and where it binds with the hemoglobin and the myoglobin in the concentration of 85% and 15% respectively. The elimination of carbon monoxide from the body occurs exclusively through the lungs. Carbon monoxide poisoning affects readily to those persons who are old, anemic, diseased, suffering from the cardiorespiratory diseases, drugged and the drunks. Carbon monoxide particularly affects those organs which have high oxygen demands, for example, heart and the brain. So, the clinical features are mainly associated with the myocardial infarction, pulmonary edema and the arrhythmia, and in the brains, the features of the hypoxia are seen, which is the most sensitive organ to the hypoxia. So, in this way, its effects are seen on the body. Differential diagnosis in case of the carbon monoxide poisoning is the alcohol intoxication, migraine, meningitis, epilepsy, encephalitis and the hysteria. These conditions may mimic the carbon monoxide poisoning like features. Here you can see in the picture the hypostasis pattern that is produced in case of carbon monoxide is the cherry red discoloration. So, the different types of the hypostasis colors may help to diagnose the type of poison. This we already discussed at the beginning of the lecture, that the different types of the colors that are produced with the different types of the poisonous substances in case of the hypostasis. Here we can see the cherry red discoloration that is produced in case of the carbon monoxide poisoning. Then the clinical features in case of carbon monoxide poisoning depends upon the concentration of the carbon monoxide in the blood in form of the carboxyhaemoglobin. If the patient has the mild carboxyhaemoglobin concentration that is less than 30 mg/%, in that cases the symptoms presented by the patients are the headache, nausea, vomiting, dizziness, exertional dyspnea. If there is a moderate rise of the concentration of the carboxyhaemoglobin, it presents that is around the 30 to 40%. Then the patient presents with the chest pain, blurred vision, confusion, weakness, increased dyspnea, tachycardia, tachypnea, ataxia, severe headache, syncope, flushing, cyanosis, perspiration, decreased vigilance, diminished manual dexterity, impaired sensorimotor task performance, prolonged reaction time, difficulty thinking, impaired judgment, loss of the muscular control, tinnitus or the roarings in the ears, drowsiness, hallucinations and the cardiovascular toxicity. That is in the moderate dose, these all features are presented in the patients. Then in case of severe toxicity, that is carboxyhaemoglobin concentration is more than 40%. In those cases, patients presents with the trismus, muscle spasm, convulsions, palpitation, disorientation, ventricular dysrhythmia, hypotension, myocardial infarction, Here it is important to note skin blisters are also seen in case of carbon monoxide poisoning. This is one of the unique features seen in cases of poisoning. So you must know what all poisons are producing the skin blisters and their differential diagnosis. That is important. Many patients may come with the dermal issues and in the skin department for the treatment, and they may occur due to the toxicity of the certain poison, like the case of the carbon monoxide. So this must also be thought. Then the patient may present with a pulmonary edema, respiratory failure, involuntary evacuations, coma, collapse and deaths. In case of carbon monoxide poisoning, it poses a significant threat to life due to its colorless, odorless nature and the rapid onset of the symptoms. Like someone puts the heater on in his room and it starts producing the carbon monoxide and room is closed from all around. If some other gas would have been there, then he could appreciate the smell of it. But as the carbon monoxide is colorless and odorless, so patient is not able to recognize the effect of the carbon monoxide and he keeps on inhaling this carbon monoxide, and many times it is only realized when the patient succumbs to death after the inhalation of the carbon monoxide, or he kept his heater on in his room with the room all around closed, and he may die due to the carbon monoxide poisoning. He was found unconscious. This type of news and this type of reportings are there in the literature. So in this way, the carbon monoxide causes its effect. The severity of the carbon monoxide poisoning is categorized into the 3 levels based on the carboxyhaemoglobin levels. Mild poisoning, that we already talked, 10 to 30% of the concentration. In those cases, patients exhibit mild to moderate poisoning symptoms, while in case of moderate poisoning, that is concentration between 30 to 40%, patients mainly presents with the severe symptoms like chest pain, confusion, and in case of severe concentration of the carboxyhaemoglobin, that results mainly in the cardiovascular and the central nervous system effect, including arrhythmias, coma and the respiratory arrest. Uncommon signs of the carbon monoxide poisoning include the cherry red discoloration of the skin and the mucous membrane and the mucous membranes occurring at carboxyhaemoglobin levels at 40% or the higher level. Skin blisters may also develop in specific areas. These signs are rare and often indicate a lethal carboxyhaemoglobin level. Delayed effects of the carboxyhaemoglobin poisoning include the carboxyhaemoglobin encephalopathy occurring 2 to 40 days after the exposure. It is characterized by demyelination of the brain's white matter. Symptoms include the retrograde amnesia, impaired attention, dementia, psychosis, personality changes, mood disorders, and suicidal tendencies. Understanding the symptoms, severity levels, and the delayed effects of carbon monoxide poisoning is crucial for the timely diagnosis and the treatment of the patients. Early recognition of the symptoms and the prompt medical interventions are essential to prevent the adverse outcomes associated with the carbon monoxide exposures. Public awareness and education plays a vital role in preventing the carbon monoxide poisoning, and prompting the safety measures in home and workplace can save the many lives. This is all for today. We shall continue in the next class. Thank you.